important stainings, and this is the important stainings in pathology and microbiology. So firstly, we are going to look at some questions. So where is the H&E stain used? Next is, where is Alcian blue? Alcian blue, where is it used? Warthin starry sign is used in what condition? Stain is used in what condition? So we'll find out the answers to these questions and a lot more in this video. So firstly, there is the H&E stain. We are going to focus on pathological stains first. So under H&E stain, this is used, it is most commonly used stain in case of the routine histopath examination it is used. And what about the disorders? In case of the disorders, it is commonly used for all slides. It's used for all slides. Next, we look at the Papani close stain. So this stain, it is a universal stain for the cytological preparations. Cytological preparation, and it is universal. Universal stain. And looking at the disorders, it is used in case of the cytological studies, as we mentioned. Then we move on to the PAS stain. So the PAS stain, it is used to demonstrate the glycogen as well as the mucin and the fungi and the macrophages. Then looking at what are the conditions it is seen. So it is used in case of disorders such as the Whipple's disease, also in case of the adenocarcinomas, then in case of the glycogen positive tumors. So what are the glycogen positive tumors? It includes the Evans sarcoma as well as the renal cell carcinoma. Next, we look at another staining, that is the PTAH. So this is nothing but the phosphotungstic acid hematoxicin. So this is used in case of the fibrin, staining the fibrin, and the disorders, it involves the gliomas. Next, the ependymomas. Then also the tumors of the skeletal muscle as well as the fibrin deposits. Then we move on to the other staining, that is the Alcian blue. So the Alcian blue is for the acid mucins. So it stains positive. So the staining is positive for the mucins of the intestinal mucosa, and it is negative. It is negative for what? It is negative for the mucosa of the mucins of the mucosa of the gastric region and also the Brunner's gland. Now looking at the conditions, it is seen in case of the Barrett's esophagus. Next, as well as the gastric disorders. Then we look at the staining, that is the Pearl's Prussian. So Pearl's Prussian blue. So in case of Pearl's Prussian blue, it is used to demonstrate the hemosiderin. So the hemosiderin as well as the iron. So the disorders it includes is the hemochromatosis. Next, we look at the Mason's-Fontana stain. So what is the Mason's-Fontana stain? It is used to demonstrate MM. So it is used to demonstrate the melanin. And the conditions it is used in conditions such as the nevus and the malignant melanoma. Next, we look at the von Cosa method. So in this particular method, it is used to demonstrate the calcium. And what about the disorders? The disorder is used in case of the calcification of the tissue.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.